Let's now go to your section with hierarchy of House Greyjoy-242. A client is diagnosed with tuberculosis or TB. In addition to recommending skin testing of the family members, TB should be reported to which of the following individual or agency. Now, remember that all communicable disease like TB should be reported properly uh, for investigations. Okay, and this communicable disease must be reported to Boston local health department, your rural health, or your health centers, because they are the one that is responsible to collect this data. And after they collect this data, they will submit this to, it's either DOH if you're from the Philippines, or Center for Disease Control if you're in America, or if you're trying to study NCLEX. So for local boards, it's DOH. For NCLEX, it's CDC. Okay. So, and aside from that, local health department is the one mandated by the law to study the occurrence, the frequency, prevalence rate of these communicable diseases. Okay, B is the best answer. Number 22. The usual treatment for tuberculosis or TB includes the use of isoniazid and which of the following therapy? A. Theophylline. Okay, obviously this is wrong because theophylline is a bronchodilator. Okay, it's not an antibiotic. It does not kill TB. Okay, and let's eliminate your penicillin because this is not used for TB. It's not used for TB. Now between C and D, the best answer is letter C. Three other antibacterial agent. Okay, this is what you call your multi-drug approach. Why do you need to have a multi-drug approach? This is to prevent the occurrence of what you call your resistance. Okay, to prevent the occurrence of resistance, we give at least 3 anti-TB drugs. Okay, that's your multi-drug approach. Okay, we do not use pentamidine for TB either. Eliminate that, so C is the best answer. How long do most clients receive treatment for tuberculosis? For TB drugs or treatment usually lasts. Treatment for TB, usually in the Philippines, it's between 6 to 12 months. In United States, it's usually 9 to 12 months. Either way, both of them should at least 12 months. Best answer would be Boston. Okay, this is the usual treatment or usual duration of treatment for TB. Next, number 24. For what length of time is a client considered infectious after treatment for tuberculosis is started? Now, according to your book, usually clients who started on TB drugs are not communicable after 4 weeks. Okay, and to confirm this, okay, the doctor or the uh, medtech may conduct an AFB or acid fast bacilli staining, and if the sputum is negative for bacilli, then that confirms that the client is no longer communicable. So this is the answer there. Next, 25. A client tells his nurse that his tuberculosis medications are so expensive that he cannot afford to take them. Which of the following intervention by the nurse is best? Now remember that TB drugs are free on rural health or local health department. So you should refer the client to letter C, your local or your country health department, because TB drugs here are free. Okay, next, number 26. A 62-year-old client is admitted to the hospital with pneumonia. He has a history of Parkinson's disease, which the family says is progressively worsening. Which of the following assessment is expected? So we're trying to look here an option that uh, contributes or support the statement of the family that the Parkinson's disease is progressively worsening. Now, which of the following assessment is expected? Now, first, let's try to eliminate Boston because there's no flaccidity in Parkinson disease. There should be what? Rigidity of muscles, not flaccidity. Okay, flaccidity can be seen on um, paralyzed clients having no or absent muscle tone. That's flaccidity. Next, eliminate Dallas because the tremor of clients says your tremor fingers increase with purposeful movement. No, the tremor of these clients occurs at rest, not with movement. So between A and C, best answer here is letter A. Client who have Parkinson's disease has impaired speech. This is due to what you call your bradykinesia. Okay, client cannot speak or cannot move the muscles around the mouth well. That's why there's impaired speech. There's no pleasant or smiling demeanor because the client has what you call your mask-like affect. Because like I said, the muscles are rigid. Clients cannot move the facial muscles normally as possible. That's why A is the answer. Next, number 27. Which of the following terms describe a clinical judgment that an individual, family, or community is more vulnerable to develop a certain problem than others in the same or similar situation? A. Risk nursing diagnosis. B. Actual nursing diagnosis. C. Possible diagnosis. Or D. A wellness diagnosis. Okay. Based on the situation, we're looking for an option that is supportive or congruent to when a certain family is more vulnerable to develop a certain disease. So automatically, let's eliminate wellness because in wellness, there is no problem at all. Okay, there is no problem at all in wellness, and we only use possible diagnosis if data is not enough. Okay, data is not enough. If there are some missing data about the clients, for example, you were assessing your client and you're not done with your assessment and then the client was already transferred to the operating room, so you did not finish your assessment. That's the time you perform or you do possible diagnosis. Between A and B, going back to the situation, there is no disease yet, but the family is more vulnerable, which means it's letter A. It's a risk problem. Therefore, you should make your risk diagnosis. Next, number 28. Which of the following intervention is best to decrease a client risk for skin breakdown? A. Specialty mattress. B. Position the client in alignment. C. Reposition the client every 4 hours. Or D. Massage bony prominence. Now let's try to eliminate first letter C because it should be what? 2 hours. You reposition the client every 2 hours, not 4 hours. Letter B, position the client in alignment position, eliminate because this is to prevent contractures, not bed sores. And we all know that this is contraindicated because it increases further skin breakdown. You should avoid massaging bony prominence. Eliminate the best answer, letter A. Now, I don't know if you have seen some mattress who has like this. Okay, this is a specialty mattress to prevent skin breakdown. So letter A is the best answer. Next, number 29. An 82-year-old male client with Parkinson's disease is frequently incontinent of urine. Which of the following intervention is appropriate? First, letter A, diaper client. B, apply condom catheter. C, insert an indwelling catheter. Or D, provide skin care for or every 4 hours. So let's try to eliminate wrong options first. Eliminate D because skincare for a client who has urinary incontinence should be as needed. So every time the client urinates, you should provide skincare. Okay, so it should be as needed, not every 4 hours. And eliminate C because your client will be high risk for urinary tract infection if you prefer indwelling catheters. Between A and B, it's between diaper or condom catheter. So better answer would be Boston. Why? Because in diaper client, the skin is still exposed to the urine. Remember? That's why there is still a chance of skin breakdown in letter A. Remember that a skin that is constantly wet is more prone to breakdown. That's why best answer is Boston. Next, number 30. Family member report exhaustion and difficulty taking care of the family member. Which of the following approaches is best interest of the client? So, in short, which one will benefit the client most? Is it A, ask the client what he wishes? B, have the family member discuss it among themselves? C, tell the client that tell the family that the client should go in a nursing care facility. I don't think this is best for the client. Or D, call a family conference and ask social service for assistance. So obviously it's not C, and um, obviously it's not A, because if you ask the client basically has no choice, because based on the situation, the client is dependent. So it will be up to the family member. Okay, the decision will be up to the family member. So it's not A. So it's between B and D. Best answer will be Dallas. Okay, a social service can provide counseling to the family member about different alternatives of care. Because based on the situation, the family member are exhausted and they are difficult in taking care. One of the substitute for this is nursing facility, but I don't think this is best for the client. Remember, there are different alternatives of care, and the family should focus on the other alternative aside from placing the client to the nursing care facility. And only a social service can give these alternatives of care. That's why Dallas is the best answer. Next. A 30-year-old preemie gravida in her second trimester tells a nurse her fingers feel tight and sometimes she feels as though her heart skips a beat. She has a history of rheumatic fever. Which of the following indicates the client may be experiencing cardiovascular disease? A. Clear lung. Eliminate. Obviously, clear lung is not a manifestation of cardiovascular disease. B. Sinus tachycardia. C. Increased dyspnea on exertion. Or D. Runs of paroxysmal atrial tachycardia. First or second thing is eliminate B, because although it says here it's tachycardia, it's of the sinus type, which means this is normal or it is regular. What's the problem or what's the concern should be if the heartbeats are irregular. But since it's sinus, it means it's regular. Another regular heart rate is Dallas. Paroxysmal atrial tachycardia is also a form of heart rate which is considered to be regular in rhythm. That's why D is not the answer. Best answer, letter C. Increased dyspnea on exertion is an indication of cardiovascular disease. Next, 32. Which of the following diagnostic tests determine the extent of cardiovascular disease during pregnancy? So, is it A, stress test, B, chest x-ray, C, echocardiogram, or D, cardiac catheterization? Now, what are the different elements you need to consider? First is there's a cardiovascular disease, and we're trying to choose what type of diagnostic test is appropriate for a client who has not only has a cardiovascular disease but also in pregnancy. So which one of the four is for checking cardiovascular disease? as a diagnostic test for a client who is pregnant. And we should remember that your client is pregnant, and therefore we should choose the least invasive type of diagnostic test, and that is letter C. Echocardiography is the least invasive. Therefore, it's the most appropriate diagnostic test for for cardiovascular disease to a pregnant client. The rest are invasive, more, or should I say more invasive. Next, number 33. Which of the following factors is assessed to determine the effects of a client's heart condition on the fetus? Is it A. Urinalysis, B. Fetal heart tone, C. Laboratory test result of the mother, or D. Other signs and symptoms of the client? First, let's try to eliminate. The situation is trying to ask what part of the fetus should you assess to determine the effects of the mother's condition. So the client who has a heart condition is the mother, and you want to find out if this is affecting the fetus. Now, if you want to find out the effect of that on the fetus, what aspect of the fetus should you assess? Obviously, it's not urinalysis. You cannot check the urine of the fetus yet. Okay, and other sign and symptom of the client is obviously wrong because remember we're trying to find out the parameter on the fetal side, not on the mother side. Between B and C, best answer is Boston. Remember that fetal heart tone will reflect the fetal response to the environment. To the environment. Now, this environment refers to the mother. Remember that the fetus is inside the mother. Therefore, the environment is the mother. So, whatever happens to the mother, it may affect the fetus. And the best way to check the effect on the fetus is to check the fetal heart tone. Okay? Next, number 34. Which of the following factors is an example of subjective data in a nursing assessment? A. Laboratory. This is objective. B. Physical assessment. This is also objective. Between C and D, best answer, Dallas. Letter C. Report of a diagnostic procedure. This is also objective. While a client's feeling and statements about the health problem is considered subjective. D is the best answer. Next. Which of the following classification of medication may be used safely for a pregnant client with cardiovascular disease? A. Antibiotic. B. Warfarin. Eliminate. We all know that this is contraindicated because it crosses the placenta. C. Cardiac glycosides, or D. Diuretics. See? So, going back to the situation, the client is pregnant and has a cardiovascular disease. Okay, first let's try to eliminate letter A because this is not for heart problems. And the fact that it only says antibiotic, it's a vague word. It could mean anything, right? So there are some antibiotics that can be given to a mother, a pregnant woman, but there's also some antibiotics that cannot be given. So to just say antibiotics is a general word, so it could mean anything. So it must be eliminated. Between CMD, now if you will read your books, your book says diuretics should be used with caution to pregnant clients. It must be used with caution to pregnant client. So eliminated, best answer is letter C. Cardiac glycosides can be used safely to pregnant clients. And it is also a drug for what? Cardiovascular disease. To be specific, heart failure. Okay? Number 36. Client arrives at the emergency department in her third trimester with painless vaginal bleeding, which the following condition is suspected. A. Placenta previa. B. Premature labor. C. Abruption placenta, or D. STD. First, let's try to eliminate C because this is what? Painful, not painless. And STD is not manifested by bleeding, right? It should be manifested by like abnormal discharge from the vagina and so on and so forth. Between A and B, obviously this is letter A. Placenta previa, the typical symptoms manifestation of placenta previa is painless vaginal bleeding. Okay, number 37. Which vital sign applying after vital signs and applying an external monitor? Which of the following intervention is a priority for a client suspected of placenta previa? Now, the client is suspected for placenta previa, which means there are already manifestation. That's why you suspected that the client has placenta previa. Is it A, an indwelling urinary catheter? B, plan for an immediate cesarean delivery? C, place the client in triangular and birth position? Or D, obtain a blood work and start IV? Now, we all know that placenta previa is manifested by what? Painless bleeding. Unless, of course, there is a total obstruction of the cervical canal or cervical OS, then that's the time there is no bleeding. But most of the time it has. Now, if the client is bleeding, you would anticipate that the client may need blood transfusion later on. And prior BT, you need to check what? Compatibility. Aside from compatibility, cross-matching. And to make it short, these are your blood works. And since the client is losing fluid, you need to start IV to replace that fluid. Therefore, best answer, Dallas. Eliminate C. You should not avoid, or you should avoid triangular and bird position. Inserting an indwelling urinary catheter is not needed in this client, while planning for an immediate cesarean would be decision of the doctor. Therefore, Dallas is the best answer. Next, number 38. Pregnant client with vaginal bleeding asks a nurse how the fetus is doing. Which of the following best is the best response? Is it A? I don't know for sure. Obviously, that's wrong. B, I can't answer that question. That's wrong. Of course, you can and you must. Remember, it's your responsibility to teach your client. Between C and D, best answer would be, or a better answer would be Dallas. Tell to the client what the monitor show. Okay? This is a matter of fact. You're just telling what is the truth based on the monitor. So there's nothing wrong with that. It's better than saying it's too early to tell anything. Next, 39. A client with placenta previa is hospitalized and a cesarean delivery is planned. In addition to the routine neonatal assessment, the neonate should be assessed for which of the following conditions? A. Prematurity. B. Congenital anomaly. C. Respiratory distress. Or D. Aspiration pneumonia. Going back to the situation, client has what? Placenta previa. And CS is planned. In addition to routine neonatal assessment, the neonate should be assessed for which of the following. So after the delivery of the newborn, aside from your routine assessment like your APGAR, whatsoever, what should you add? Answer should be letter C, respiratory distress. Why? Because the client was delivered cesarean. Basically, more fluid are retained in the lungs. Now, aspiration pneumonia is not actually a problem unless there is what? Presence of meconium. So the best answer here is letter C. Eliminate them. These are not associated with placenta previa. Next, number 40. A neonate requires blood transfusion after birth. Which of the following cannulation site is most preferred? A. Scalp veins. B. Intraosseous. C. Umbilical cord. Or D. Subclavian cut down. First, let's eliminate D because this is the least desirable. Why? This is the least desirable because it is very long to perform. It takes time before it can be performed. While umbilical cord is the best answer because it's the easiest. By umbilical ball is the easiest way, easiest cannulation. So it's the preferred. Letter A is the alternative to umbilical. If umbilical cannot be used, scalp vein can be. So eliminate that. And interosseous should is an alternative to scalp vein. If scalp vein cannot be used, interosseous can be. So eliminate that. So best answer is letter C. So that ends your this section of your module. I hope you got very high and I'm looking forward to the next section. Thank you and goodbye.